Hello and thank you for joining us for today's Feed Your Mind webinar. This series is part of Age Friendly Arizona. We are a network of communities dedicated to connecting older adults with people of all ages. Age Friendly Arizona is supported by partners statewide and beyond, including AARP-AZ, Virginia G. Piper Charitable Trust, and grant makers in aging. Please check www.connect60plus.com for news about upcoming webinars and for recorded webinars that have aired previously.
Hello, this is Kathleen O'Connor. I'm with the Center for Healthy Aging at the Banner Sun Health Research Institute in Sun City, Arizona. And I'm planning to talk to all of you about the benefits of optimal aging. This is specifically for Age Friendly Arizona, so I'll try to make some references to how we as community leaders can engage our seniors and those that work with our seniors. So the main objectives will be to describe optimal aging. I like that term, and I'll explain why, and its impact in Arizona and the U.S., touching a little bit even on international. I will talk about the longevity study, Learning from Our Elders, which is the main study that I work with at Banner Sun Health Research Institute. I'm the manager of the Center for Healthy Aging, and now we will be embarking on a few other activities that I'll mention at the end of my talk. So moving forward, the first thing I'd like to talk about is the definition of optimal aging. And over the past 10 to 15 years, there's been a lot of discussion about successful aging. And although I like the positive connotation it brings, it also eliminates some of the things that go on as we age that we have to deal with. So successful aging, as you can see, absence of disease and disability, high cognitive and physical functioning, and active engagement with life. Doctors Rowan Kahn wrote a book called Successful Aging that was quite popular, and although I don't dislike the term, I would prefer to see the term optimal aging, which is the capacity to function across many domains: physical, functional, cognitive, emotional, social, spiritual, and maybe even other facets, to one's satisfaction and in spite of one's medical conditions. And I have to honestly say, this is really the attribute that I see that stands out with our longevity study cohort of aging adults, age 50 to well over 100. You know, everyone faces challenges as they age, whether it be mental decline, or physical chronic conditions that they experience, or just physical decline that occurs as we age. But what I really am impressed by with this group for the most part is their ability to adapt through these challenges and find ways to still lead a productive life despite what they're dealing with. So that's why I really like that term most. So just a little bit about aging in the U.S. I find this graphic to be very telling because we know that the older population is growing in leaps and bounds throughout the country. But we kind of think that the majority of our retirees live in the great state of Arizona or in Florida. And you can see that the dark maroon colors are highlighted in those states. But I'd like you to take note of the high percentage of the elderly population over the age of 65 in the Great Plains states in the middle of our country. Many people are not aware of this. What is going on there is we're seeing a lot of the younger generations out migrating while the older generations are aging in place. They prefer not to leave their homes. These are like the states of Kansas, Nebraska, North and South Dakota, even parts of Colorado, New Mexico, Oklahoma, and Texas, as you can see by the graph. It just is nice to know where our elders are, and if you're looking at a career in aging, these are where the most of this population is living, although we are aging in all states throughout the country. I'd like to also make a note, because of what our purpose is here at our research institute, is focusing on neurological diseases of aging, such as Alzheimer's disease and Parkinson's disease. I wanted to make mention that Arizona is the 4th largest state in the country with the highest number of diagnosed dementia cases, Alzheimer's disease being the most common. And it really doesn't surprise us, because we do have a large amount of older adults, and the standard of care here is pretty high, I would say, from what I see within what we do here. Why is this so important? Well, Alzheimer's disease can cause substantial financial and emotional burden on families and caregivers. And individuals that do get diagnosed with a dementia can live with the disease a decade or even more. So it's extremely important that we have early diagnosis and treatment to improve quality of life for these folks and those that are caring for them, and to extend their independence, which also can lead to less hospitalizations and less medical care the longer they stay more vital and alive with their disease. So going along with the definition of optimal aging, I really like the term compression of morbidity. My background is in gerontology, and this was one of the terms I learned when I was going to school. And it really is what we're seeing with the oldest of old here in the U.S. and throughout the world. What is happening is people are living longer periods of good health, followed by a diminishing period of ill health, very close to death. And isn't that what we all hope for, to have quality of life for as long as we can? In addition to that, if we can maintain our functional reserve and adaptive capacity, which is another gerontological term, which just means, people that are really able to adapt through situations and maintain their functioning as long as they can. And I honestly can tell you that is depicting of our study here in Sun City a great deal. So for those of you that like to kind of see it, to see the extent of the growth of the older population here in the U.S., this is just simply saying we know it's growing. Those that are 65 and older, they'll be close to 100 million by 2060. And as far as the oldest of old, which in most terms is those that are 85 and older, there will be more than 20 million by 2060. And by the way, that is the fastest growing population here in the U.S. I found these slides just recently from the U.S. Census Bureau, and I think it really is very telling of how our population is changing. By the year 2030, we are looking at baby boomers. Those are all going to be older than the age of 65, and they will be 1 in 5 of the residents that we have here in the U.S. And this graph shows you that, back in the 60s, 70s, 80s, we were really more of a pyramid look, but now the population is filling out. We have more and more people living long lives, so it looks more like a pillar. Another graph from the U.S. Census Bureau shows that by 2020 there will be 3.5 working age adults for every retirement age adult. Interestingly enough, the older workers are growing, and more people are also opting to continue working greater than the age of 65. So again, this is going to be a big shift. One of the things we found in our longevity cohort when we analyzed some of the data related to those people that work and volunteer into their later years, overall they had higher mental and physical functioning compared to those that retired and decided not to work or volunteer for no pay. So, interesting fact that seems to be fulfilling itself as more and more people retire but don't really retire because they're doing either paid or non-paid work. The next slide is just showing you that the good old state of Arizona is also growing in leaps and bounds, no question about it, with their older adult population. So these increases will also be accompanied by a decrease in the proportion of working age Arizonans who help support our older adults in numerous ways, including paying taxes and on wages that help fund Social Security and Medicare. So we're going to see some shifting in the financial structure as well. But interestingly enough, the point I made earlier, we'll see more older adults continuing in the workforce. The other thing we see in Arizona and throughout the nation, frankly, is the growth of diversity. So those that are over the age of 65, we're going to see more and more diversity. In Arizona, in particular, we'll see the Hispanic population continue to grow, and with the older adult population, it could even grow beyond the white Caucasian numbers. Why is this important? Well, it is important because we need to look as a state at public health interventions to improve the overall population health of aging Americans, and we need to look at the different cultures and how we can address unique situations in each culture. I have a particular fondness for our centenarians, which are those individuals that are over the age of, well, 100 and older. We have had up to 50 in our study. Unfortunately, now we are down a bit with our numbers. But this is also a population that is growing in leaps and bounds. And it will continue to grow, and it will continue to be more diverse. So this is showing you that by 2050, there will be almost 8,500 centenarians here in the United States. Just one slide on worldwide, just to give you perspective. Not surprising that China is at the top. They will hit 1 million centenarians in 2069. Soon to follow will be the United States. So there's to give you an example of how, you know, we're really growing in our numbers and also how long people are living. This is just a picture from 2014. We had a special event called Love of Life at 100 Years and Beyond, and we invited all of our centenarians that were able to make it from our study. I think we had close to 16. We had the media there, and we really rolled out the red carpet for them, and they were able to share individually a little bit about their lives. We're excited to say that we're going to do this again. In March of this coming year, we're going to have a Fabulous at 100 celebration to celebrate the lives of those in our study that are 100 and older today or this coming year. Along with, I believe we'll be inviting a few centenarians from outside the study as well. If you haven't heard the term supercentenarian, that is anyone that has a validated age of 110 years or more. And there's a website that I have listed on the screen, the Gerontological Research Group. I have their link there for you. And they are tracking the validated living supercentenarians worldwide. Unfortunately, the U.S. doesn't have a federal or central database on the world's supercentenarians, but they're working towards having a complete data by the year 2040. So this has been a really difficult endeavor, but they're really working towards having this happen. So the the numbers up on my screen are as of October, and these are folks that have provided, or their families have provided, documented birth certificates. So we have 34 females to 2 males at this point, with the average oldest living individual being at 113.43 years old. I wanted to make mention of another interesting term called healthy life expectancy. And this is the years that people have lived without physical and mental impairments. And I did some research on the Arizona Healthy Aging Plan that came out of the Arizona Department of Health Services. They have a plan for 2014 to 2018. And what they have come up with is that Arizonans who turn 65 can expect to live an additional 20 years on average. That's your regular life expectancy based on the statistics today. But out of those 20 years, 13 of them, on average, will be years lived without physical and mental impairments. So again, that's kind of talking about that compression of morbidity we talked about earlier, that it will be a longer period of time that people will have, living life to the fullest as long as they can. So I'd like to transition my discussion right now on a question I'd like to raise to all of you that work with the senior population or within communities that are engaging with seniors. So what are the strategies to reduce threats to healthy aging and increasing that health life expectancy that I just talked about? How can we promote healthy aging? Well, we all know, we hear on almost a daily basis the very practical things that we can do and we can encourage seniors to do to stay healthy and improve their quality of life. I just took a different stance on it to give you maybe a little different perspective from those that have lived very long lives throughout the world. And if you're not familiar with the book and the research on the blue zones, I'd like to share a little bit of what Dan Buettner, he's an author that has written a lot and researched a lot on the blue zones throughout the world. And these are communities whose elders live to record-setting ages. And the 5 areas that he highlights, the 5 blue zones, very briefly, are an area in Sardinia, which is an island off of the country of Italy. They have the world's highest concentration of male centenarians, which is amazing because we don't have men living as long as women. There's also an area in Greece off of the Aegean island of Iteria with one of the world's lowest rates of middle-age mortality and the lowest rates of dementia, interestingly enough. We have an area in Costa Rica, which has the second highest concentration of male centenarians. We have an area right here in the United States in Loma Linda, California, which is a population of folks that practice Seventh-day Adventist religion. And on average, they live 10 years longer than the North American counterparts. And last but not least is Okinawa, Japan, which is where the longest-lived females live in the world. So why am I bringing this up? Well, they have come up with some trends with these areas in the world and what can contribute to people living long and quality lives. And I thought some of them are very much familiar to us, but it's taken on a little different twist because this is international and maybe some thoughts that you hadn't thought about. So these are the 9 healthy lifestyle habits. The first is moving naturally. So places throughout the world do not have, all of them that I've identified, do not have high-tech gymnasiums and people running marathons necessarily. Instead, they live in environments that constantly nudge them into moving without even thinking about it. So that's the first one, how you can be in an environment that you can naturally live but stay very physically active. The second is having a purpose or evaluation of life. So we have those, in Okinawa that call it Ikaiji, that translates to why they wake up in the morning. And we actually ask our folks in our study that question, what gets you up in the morning? What motivates you? And for the most part, it is knowing that you have still a purpose in life, no matter how old you are. And having purpose, according to the research, extends your life by about 7 years. The third is downshifting. Well, we know even in the blue zones, people experience stress, and we know that can lead to lots of problems associated with almost every major age-related disease. What the world's longest-lived people have that we don't are routines, again, natural routines to shed that stress. So Okinawans, for example, in Japan, take a few moments each day to remember their ancestors. Adventists in California pray. Italians take a nap, and Sardinians do happy hour. And we'll talk more about that in a little bit. The fourth is the 80% rule, which is talking about basically not eating until you're absolutely full, maybe till you're about 80%, and that 20% gap between not being hungry and feeling full could make a huge difference. So people in the blue zones eat their smallest meal in the late afternoon or early evening, and then they don't eat anymore for the rest of the day. This next one is a plant slant, which means we know that fruits and vegetables are at the top of the food pyramid, even with U.S. guidelines. But what they're focused on in many of these countries and areas where people live long is the focus on beans and lentils as a big part of their diet. And they limit the amount of red meat, particularly pork, to only a few times a month. And probably most importantly is looking at serving sizes for meat being on the small side. The next they call wine at 5. Drink modestly with friends and food. And modestly is an interesting term because I would have probably said in moderation. But basically, their research is showing, except those in Loma Linda that do not drink, moderate drinkers outlive non-drinkers. The trick is to drink only 1 or 2 glasses per day, which seems excessive perhaps in our standards, but in Sardinia, that is part of what you do with friends and family, and it's part of their socialization. The next one is belonging, which I think probably is one of the most important, along with loved ones first, family and friends, social networks. Those in these different areas, most of them live and belong to some sort of a faith-based community. Denomination doesn't seem to matter, but research shows that attending faith-based services on a several time a month basis can add up to 14 years of life expectancy. It's kind of pretty apparent that loved ones are important in this group, and it's also keeping aging parents and grandparents nearby or in the home is very important. They invest in their children, and it's like a #1 priority in all these parts of the world. And last but not least is right tribe, born into or choosing the good network to be in. So whether you're born into or you have a social network outside of your family that supports healthy behaviors, it can make a real big difference. And it actually favorably shape their health behaviors. Laura Carstensen is a gerontologist that actually went to Sardinia to interview some of the centenarians there. And she did a TED Talk that I can certainly share a link on if you're interested. But basically, the thing that I took home from her presentation was the importance of social network. So let's face it, when people are living to these long ages, they sometimes have outlived most of their family. So what is their social network? It is those people that they interact with on a daily basis. So her example was talking to a male centenarian who, for him, visiting his barber and going to the baker, for example, for his sweets, those two people were like very important social networks for him on a regular basis because a lot of his family is no longer living. But he has a purpose and he has people to visit, and that's what makes it work for him. So I wanted to take a few minutes to just talk a little bit about our longevity study here at Banner Sun Health Research. We've been collecting data for over a decade now and looking at people's secrets to their healthy aging. We're also doing things to help in the community to maintain positive and a healthy lifestyle. And I'll mention one community program we'll be starting this coming year. So this study is Institution Review Board approved, which means we're following all the protocol for a research study. Our principal investigators are Dr. Atri, Zammarini, and Dr. Kuhn. Got their affiliations there on the screen. And just a few pictures to give you an idea. On the top right, that's myself in the middle with my colleagues, Debbie and Sharon, and basically we are the staff for the longevity study, along with our two leaders on the bottom. They're solo pictures. The rest of these pictures, amazingly enough, depict all of the volunteers that contribute hours and hours of time to make our study work. We have those that actually get trained to become professional interviewers for our study, and then we also have many that work in the office and help with our data. And they are all trained and on the confidentiality of being in a research study. So it's been a great success. This just gives you an idea of the numbers currently we have in the study. Over 630 at this point as we approach the end of 2018. The total participants in the database is just equivalent to everyone that has contributed at least a year or more into our study, but have either passed on or relocated and are no longer in the study. But we still maintain over 600 active folks, and we are continually enrolling about a dozen a month. This is what we call in research what inclusion criteria we have for the study, which is pretty minimal. We have recently added that we really would like people to be cognitively well upon entry into the study, and we do some brief screenings by phone to determine that. This is just a very general list of all the things we gather. We use a lot of validated questionnaires that are out there in the research. We do a lot of psychosocial questionnaires, how people feel about life. We administer some brief memory screenings every year to monitor change over time. We also touch upon their physical health and activity, their diet, a little bit on family history, and every year there's something new added, but we do ask a lot of repeated questions because we really want to see how people change over time. And if I had to sum it all up, this is the recipe for optimal aging. Certainly not the only things that contribute, but certainly some of the most important. If I could touch on just a couple, attitude, in my opinion, is probably number one. You know, those that maintain a positive attitude and focus on what they can do versus what they can no longer do are successfully going through the aging process. One telling question we ask related to attitude is, how old do you feel most of the time? And on average, the folks in our study feel 15 to 20 years younger than their actual age, which says a lot about their attitude. If I could touch on one other one, it would be usefulness. Usefulness, as one gets up in years, may sound to be difficult. However, I have seen people in their 90s and 100s that still find purpose in life, whether it be being able to lend an ear to a loved one, or being able to do something that they've never been able to do, or tried something new that they're able to do as they get up in years. So it's always learning and growing with these folks. We also have here at our Banner Sun Health Research Institute a brain and body donation program, which has been enrolling cognitively well Alzheimer's and Parkinson's disease subjects for more than 25 years. And we are dual enrolling some of our folks from our study into the brain and body donation program, which is allowing us to not only explore the brain development during life as they come back every year to be assessed, but also after life. We gather all of our data and it goes into a secure web-based database available for researchers called REDCap. And we are beginning to make our de-identified data available to researchers within Banner and outside, and even outside the state. With a longitudinal study, it takes time to be able to have adequate data to be able to analyze. And I'm happy to say that we're one of the longitudinal aging studies now in the nation. There are many throughout the states, but we're the only one here in Arizona. Well, early on in the study, we looked at the oldest of old and explored what contributed to their being so self-confident and so resilient. And the things we found out were that people in our study really helped to cope through their religion and spirituality. And they do this through the questionnaires we ask. We come up with the following: through prayer, meditation, and participation in religious activities. As far as problem solving goes, they do this by breaking down their challenges into manageable steps and seeking support when they need it, rather than always thinking they need to do it all themselves. Self-confidence is really something that we see a lot in our oldest of old, and they really value their lives. Those that are staying self-confident and resilient psychologically also tend to stay more physically active. There is definitely a relationship between physical and mental. And last but not least, as I've mentioned and emphasized a few times, really finding ways to continue to find their life valuable and worthwhile at any age. This very basic graph is showing another finding we have seen as we're looking at folks' cognition over time in the longevity study. We are tracking their scores from year to year on a tool called the Montreal Cognitive Assessment, or MoCA. And you can see MoCA score is on the y-axis axis, and the age groups, the decades, are on the x-axis. And what it's just generally telling us is that from visit to visit, MoCA scores are changing very minimally, which means that for the most part, longevity participants are maintaining good cognitive function over time. Now, that is not to say all of them are maintaining their cognition, because we know that as every decade of life goes on, people have more difficulty with memory and cognition. But we are definitely seeing this trend on average with those in our healthy aging study. We also had some students a couple summers ago look at a large group in our study, average age 84, over 500 analyzed, and we found in general that physical and cognitive ability are mutually important for mental health and to ward against depression. So again, encouraging people that work with our seniors and work in the communities where they live, that the importance of staying not only physically fit, but as we call it, brain fit, and finding ways to keep your brain active and engaged with different activities that you do. Last but not least, just generally speaking, we have a very large number of people in our study that are really satisfied with life. It kind of makes sense. They're not going to volunteer for a healthy aging study if they're not doing well and pretty happy with how things are going. Interestingly, according to the Population Reference Bureau in the U.S., adults 50 and older, compared to the youngers, report the highest level of well-being and are the happiest while socializing, working, volunteering, and exercising. Again, all those things we've kind of touched upon throughout my talk. When folks enter our study, we do ask them what they think contributes to their healthy aging. And then we ask them again after they've been with us for 5 years. And as you can see by this slide, these are, by the way, the oldest of old in the study that were asked. You can see all of the things that they found as being a priority and looking at the difference in opinions between men and women. And I think we probably touched on most of these as we had this discussion, with the exception of perhaps humor, which I think has a lot to do with attitude. And at the end there, it's a little bit hard to read, but avoiding negative coping. So approaching ways to manage your stress in positive coping manners versus negative. So seeking support from others, talking to someone would be positive coping, but avoiding negative coping like too much eating or drinking or smoking, for example. Other projects we're embarking on at our Center for Healthy Aging. We're very excited to be able to start a brain health check-in, which will start in January. And it's going to be a weekly opportunity for community to come in and have their brain health risk status evaluated with a take-home to take with them to their primary care provider, and if there are concerns, next steps. They'll also receive a lot of information on resources for the family and opportunities to schedule for appointments if needed. We also have a first sponsored study starting at the Center for Healthy Aging called IMAP, Insight to Model Alzheimer's Progression in Real Life. And basically this is going to be our first clinical trial at the Center for Healthy Aging, and it will not involve anything interventional. It will be no medications or testing. It will be just coming in once a year and evaluating one's memory and how it changes over time to a more extensive manner than we do in the longevity study. And we can plan to continue the longevity study registry, continue to grow it, and expand upon our publications that we have in scholarly journals. Just to give you an overview briefly of what we offer here at the Research Institute, we do have actually a memory and movement disorders clinic. So we do see folks that have memory impairment and movement disorders, and we have a team of clinicians and neurologists and nurse practitioners available. We also have clinical neuropsychology so that we can do the extensive memory testing when needed in the clinic or with a study. I already touched upon the brain and body donation program. We also have a tremendous amount of family and community services to support the individuals and families that come to our institute that live with memory and movement disorders. And they also provide support even for our healthy aging cohort when needed. So you can see, even though we do a great deal of research, we also have a lot of resources for the community. In addition to the longevity study, which we really call just observational, we do have clinical trials. So we're looking at those. I think there's about 25 different clinical trials that we offer, and these relate more to medications and brain imaging to help with new therapies for the prevention of Alzheimer's and new treatments for Parkinson's. I'd like to just kind of bring this all together. Basically, everything we do here at our institute and other research institutes, it's really revolving around the term clinical translational research, where we translate what we do to help the communities that we're with. And this is a formal definition of it that I would like to have you just kind of think about how we can improve the communication to those that may not be entirely sure that they want to get involved with research. Our mission is really to improve our patients' quality of life and to participate in some of the newest, most innovative, whether it's therapies or in the case of what the longevity study does, just to learn more about what and how people that are aging well, how they're doing. We're not really just focused on treatment, however, but on prevention and in promotion of healthy aging. So we really need community support. Interestingly enough, only 15% of people in the U.S. participate in clinical research. So what can we as community leaders do? Well, we certainly can encourage people to participate. We really need minority groups to participate. They are lacking in research, and it's needed throughout the country. We need to build trust with these different individuals that what we're doing is for a very positive reason. And when there are research entities that have excellent reputations like Banner Research, those are the ones you want to encourage people to get involved with. And then to let them know that these findings from the studies are all for the reason of improving community wellness. So we would really appreciate and encourage you to pass the word on what we're doing, and also just to encourage people to live healthy and well. And I know there was a lot of information provided here, and we'd be happy to talk more in detail about some of the other areas we work in here, but I've also left my phone number if anybody would like to give me a call, and I can certainly, if I can't answer the question, I can direct you to one of our professionals here that can be of assistance. So I thank you for your attention. And just a final thought, and I think it kind of says it in itself, but I'd like to just end with a little quote. by Iris Hallidin. You will never be old with a twinkle in your eye, with the springtime in your heart as you watch the winter fly. You will never be old while you have a smile to share, while you wonder at mankind and you find the time to care. While there's magic in the world and a special dream to hold, while you still can laugh at life, you will never be old. And it's all in the perspective, as you can see in this picture. It's all about the attitude. Thank you.